if it's picked up early and while it's still contained within the kidney, then surgery is cancers. There are different types of kidney cancers. And so again, survival depends also on the type of cancer.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am joined again by the amazing and wonderful Emily Carhill. Emily, thank you for joining us. Let's start with that of just the pathophysiology of the disease and what kidney cancer actually looks like versus chronic kidney disease.
Sure. So kidney cancer has actually been on the rise, sort of similar to kidney disease. Sort of since the 1970s, the incidence of kidney cancer has been increasing, which may partly be because we are better at picking it up, but also because a lot of the risk factors are, sort of, I guess, lifestyle type things as well. So, I guess going back to what cancer is. So cancer's when cells in the body have become abnormal for some reason and they start to grow and multiply too quickly and sort of out of control. So our body doesn't have the same checks and balances that it usually would have to keep control of these cells. And they also don't act on their own. So cancer cells also enlist, our other body cells, genes and proteins and things like that in the body to help them to continue to grow and divide. So it's, I guess, a little bit similar to kidney disease. Symptoms or signs of symptoms of kidney cancer don't often come up until the cancer is sort of a little bit larger and a bit sort of further along because some of them are quite vague. And they're also actually quite similar, to signs and symptoms of kidney disease. So things like having blood in your urine, having pain on your back, sort of on one side. Sometimes people can get a sort of a bit of a mass or a lump on one side of their back, loss of weight, loss of appetite, fever. That one's obviously different from kidney disease, and anemia. So I'll often see that people are diagnosed with kidney cancer often actually when they're getting investigations into something completely different. So they've got something else going on and they've had a scan and it's been picked up then, rather than, having signs and symptoms and going in and sort of getting those investigated.
Yeah, that's so very true, isn't it? With cancers in general, not often, but they can be one of those things that get picked up as a anomaly for other things. And I definitely know that's the case with kidney cancer, because I guess a lot of people aren't thinking kidney cancer with those sort of, and they're quite vague symptoms, really, a little bit of lower back pain. Unless you've got the blood in the urine, the rest could just be, oh, I've got a bit of a fever, I'm a bit fluey, I'm just a bit achy. I guess no one's going to be thinking of kidney cancer. And while we're still on the pathophysiology of kidney cancer, what are the survival rates and the severity of it? We know like breast cancer can, have some pretty good long-term outcomes. Yet if we compare that to something like ovarian cancer, we know the long-term rates of survival with ovarian cancer are quite low. What's kidney cancer doing as far as that goes?
It depends a lot on when it's picked up. So if it's picked up early and while it's still contained within the kidney, then surgery is generally what's recommended. And so if you're able to, when they do surgery, depending on how large the cancer is, they'll either take out the entire kidney or they'll take out part of the kidney. So if you're able to have surgery and it's diagnosed at that stage, then outcomes are definitely better. And then, it depends. So renal cell carcinoma is the most common of all of the kidney cancers. There are different types of kidney cancers. And so again, survival depends also on the type of cancer. The thing with kidney cancer, which is a bit different to other cancers, is that generally it doesn't really respond very well to chemotherapy. So chemotherapy is not often used, certainly not in renal cell carcinoma. It may be used in some of the other types of kidney cancer. But surgery is always sort of the first port of call, and then immunotherapy or targeted therapies are used more often.
So thank you, Emily. I really appreciate your expertise in this area. And yeah, make sure you hit subscribe. If you want more information about who we are at Kidney Coach, head over to www.kidneycoach.com. So until next time, yeah, make sure you subscribe, give us a like if you like this information. And if there's any specific topics you want to know, make sure you add it in the comments below. All right, have a wonderful day, Emily. Thank you. And we'll talk to you next time. Bye.